Hi, I'm Dr. Aaron Bates. We have Linda Lee with us. Linda actually is suffering from Bell's palsy. She was diagnosed how long ago now?
December 27th.
December 27th. Bell's palsy is a neurological disorder of the 7th cranial nerve. And the best explanation that we've been given as to why this might happen, what did your doctors tell you?
I have a virus in my nerves in my brain.
Right. So the theory is that there's some type of virus that has actually affected this cranial nerve. So cranial nerve 7 is responsible for your mimetic muscles, and the mimetic muscles help you. They're the muscles of your face. They're only for motor, which means they move the muscles, but they don't feel the muscles. So, like for example, if I feel your forehead right here versus right here, does that feel different? Mm-hmm. Or do they feel the same?
Same.
They feel the same, right? But if you watch, try to push your cheeks out like this, and you can see side to side, Linda is really struggling with that. Mm-hmm. Go ahead and smile. Yeah. And normally Linda has one of the most beautiful smiles you ever seen. She just lights up the room. And right now we're only getting half of that smile because you can see the paralysis is happening on the right side of the face. So what's not commonly known though is how when using chiropractic and other forms of modalities we're going to show you today can actually help to benefit the healing process much faster and much more complete. So another thing about Bell's palsy is that people can have an ongoing residual even after the nerve is healed as much as possible to where they still have maybe crooked in their smile or their eye doesn't fully close when they sleep. So with treatment, we can actually bring more resolution to that healing process. So first we're going to check your spine. Let's go ahead and go face down. Now, it should be noted that I know Linda's spine pretty darn well, even before she had this happen. And historically, where do you get most of your problems, Linda?
In my neck.
In the neck. And the upper cervical spine, where your brainstem is where 10 of the 12 cranial nerves actually stem to innervate the face. In this case, cranial nerve 7, the mimetic muscles. So we're going to do 3 adjustments to clear out her spine, her upper back, and her neck. Okay. First one we're going to do is right on T4. Then we're going to work our way down to T8. And then work our way up to the upper cervical spine. Let's take a deep breath in and let it go. Good. All right, and this T8 one is going to open up a little bit easier from a seated position. So, Linda, could you please have a seat?
Sure.
Okay, go ahead and interlace your fingers behind your neck. We're going to relax the shoulders and open this up and get you breathing better. And relax your shoulders. Excellent. Okay, go ahead and lie on your back at the top of the table. We also had a car accident, didn't we? Which of course can affect the joints and the muscles of the body. Right there, you feel that? Okay. Feel a gentle release to open up. Good. Very nice. How'd that feel, Linda?
Better.
Now we're going to decompress the occiput and the suboccipitals to open up the spinal cord and take pressure off of those cranial nerves and all the distortion it creates in the suboccipital muscles. And then we're just going to decompress the upper traps because Lord knows a lot of tension builds up with what you've been going through. Big deep breath with me. And relax. Okay, good. Just relax here. That is our traditional chiropractic adjustment. Specific, powerful. What we're going to do now is stimulate the brain stem and that cranial nerve 7 while at the same time with cold laser or low-level light therapy. And that's going to stimulate the brainstem directly, and then we're going to use exercise to also stimulate the mimetic muscles. Okay. And I'm going to rest this so I can hold on to it. Now go ahead and squeeze your fingers together. Good. Remember we did this last time, checking the strength. So when you feel this, squeeze here, this indicator muscle feels strong. So the sensory of the face, which is done by a different nerve, that's cranial nerve 5. There are no issues here, this indicator muscle. However, when we, let's say for example, try to scrunch our face down, squeeze, the indicator muscle, can you see that? Go ahead and squeeze it together. It's like her whole body just shuts down. And the reason why that's happening is because her nervous system has so many tasks to do at the same time. Well, when we ask it to do a task it doesn't do very well, all of a sudden it gets very confused, and other tasks it did very well doesn't do so well anymore. So what we're going to do is we're going to stimulate that same movement while I squeeze here, and we're going to do it over and over again while we use the cold laser. So what we're doing is stimulating the muscle and the nerve at the same time with exercise and the laser. So go ahead and scrunch your face, squeeze here. That's getting better and better already. I can feel that. Okay. And then let's just do it 5 more times. So scrunch and relax, scrunch and relax, scrunch. And I'm even gonna help her a little bit. Relax, scrunch and relax, just to guide those muscles. And we're gonna do the eyelid scrunch and relax. Good. Okay, now there's a few other exercises that we want to do. Now we want to go back to opening wide, like looking surprised, like this. And do that one more time and squeeze. And that one's weak as well, which is not a surprise. So we're gonna look surprised and relax. Good. Look surprised and relax. Low-level light therapy is very safe. Just the only contraindication is we don't want to get it in the eyes, but otherwise very safe. So go ahead and open up, relax. And if you look closely at the wrinkling of her forehead, you'll see, again, this moves really well. This actually needs some help. And relax. Good. One more. And relax. Nice. Okay, now we're going to go ahead and push out our cheeks. Like that, squeeze right there. That's actually not too bad. That's.
I can get them to work together at the same time.
You're right. It's the symmetry is lacking, but you know what? The communication, the nerve integrity is getting better. So let's go ahead and push that 5 more times. You see, it looks like and relax. Linda was either about to yawn or take a deep breath there. This is actually very tiring for the nervous system going through what she is going through right now. Relax. And again. And another big thing, just taking those deep breaths, very therapeutic, oxygenating the nervous system as we're bringing the light therapy. Okay, now we're just going to smile. Go ahead and smile and squeeze. And that one, problems there too. So go ahead and smile. Good, and just stimulating those tissues with touch and cold laser. Smile. And it's important to know that this nerve has gone through a lot, so this is a rehabilitation process. It would be highly unlikely that something like this would fix overnight, but that's not our goal. Overnight fix is more to get a complete resolution of this healing process, so we're healing more efficiently and getting a high percentage of correction. And relax. Okay. So now we're going to go ahead and sit up, and we're probably going to get pretty lightheaded here. So just be careful when you sit up. Doing okay there?
Mm-hmm.
All right. Feeling like you're floating in a cloud at all? Yeah.
A little, yeah.
Okay. We're going to use the arthro-stem to mechanically percuss and stimulate the brain stem. Push your head back. Good. Sit up taller. We're having to activate the muscles. No problem with these muscles. These are a totally different track. Sit up a little taller. Good posture means healthy Linda. And relax. How did all that feel?
Pretty good.
It was okay, totally painless, right?
Right.
Yeah, and soon we're going to be having a nice symmetrical smile. So, all right. Thank you, Linda.
Thank you, Dr.
All right.